All right, so group B, Streptococcus GBS, is considered part of the normal vaginal flora of a woman, and about 25% of healthy pregnant women do have this. But it's also associated with poor pregnancy outcomes, and this is very important for neonatal mortality and morbidity. So some risk factors for neonatal GBS would include positive prenatal culture of GBS in the current pregnancy, preterm birth of less than 37 weeks of gestation, premature rupture of membranes for a duration of 18 hours or more, intrapartum maternal fever, and a positive history for early onset neonatal GBS. So to decrease these risk factors for neonatal GBS, it's recommended that all women, once they're pregnant, to get screened between 35 and 37 weeks. And if the test does show positive for GBS, then they'll be offered antibiotic prophylaxis, which would be penicillin. So for early onset, there's early and late onset. So for early, this occurs normally in the first 7 days, but manifests within the first 24 hours after birth. It usually results from vertical transmission from the birth canal and manifests a systematic infection or respiratory illness that mimics the symptoms of severe respiratory distress. The infant can rapidly develop pneumonia, shock, or meningitis from this, and the mortality rate for early onset infection is only 5% to 20%, with the higher rates among preterm infants. So then you have your late onset, which this occurs between week 1 and 3 months of age, with an average age at onset of 24 days. This also results from vertical transmission or also from any health care acquired infections or community exposure. This is approximately 30% of infants have the late onset, and they do develop meningitis. The mortality rates are less than the early onset, but survivors do typically have some neurological damage. So if a newborn is suspected with GBS infection, the usual treatment would be ampicillin in combination with aminoglycoside. Sorry, I can't pronounce that. But if it is identified as the cause of infection, then penicillin alone can just be given. Yeah, happy studying. Woo!